Girl, you still enjoy working in that prison? Stay tuned. Travel Nurse Practitioner Working in the Prison, Part 2. Welcome back to my channel. It's Angel the Pmhnp, and I'm here with part 2 of what it is like to work in a prison as a mental health nurse practitioner. So the last video I kind of talked about how it was new for me, getting adjusted to it. And so now I'm somewhat adjusted to it. I'm in month 3 of working here, almost month 3 of working in a prison, and I love it. I actually love working in the prison in this setting. So if you haven't seen that other video, let me just tell you, I work in a prison, but the prison basically has a mental health hospital inside the prison. So it's called the Secure Psychiatric Unit. Now, we do have a mixture of prisoners, and we do have a mixture of people who are just so mentally ill that the state hospital sent them to us to kind of stabilize them and, get them in a position where they're back able to go to the state hospital, then hopefully from the state hospital back to the community. Now, I just want to tell you a little bit about how the whole thing works. So there are different units in the unit. And in the unit, they call tiers the different levels. So the goal is to have everybody go down a tier. So the higher number you're up, let's say 5, 4, 3, 2, 1. 5 is like the worst. And as you go down, you go to 2, 3, 2, 1. Once you get to 1, you're ready to go back to the community. So 5 is basically like the infirmary. So you have an infirmary, which is where the sick people go. The infirmary is actually called the infirmary for medical and for psych. So on the medical side, they have their own infirmary for their sick people. And on psych, we have an infirmary for our most mentally ill patients. Those people who are in the infirmary for psych are people who are suicidal or homicidal, or they just they just not with it. You go there and talk to them and you talking to yourself. The only thing they do is yell, scream, throw out F-bombs, B-bombs. They cuss, not necessarily at you, but they just cuss randomly, kind of like Tourette's syndrome or something. But it's not Tourette's, but this is just their behavior. Those are the people in our infirmary. If you are on a suicide watch where you actively have a plan, you have attempted to do it, you could be placed on a 1-to-1. The 1-to-1 means that a CO, which is a correctional officer, sits in front of your door all day, every shift. Somebody is assigned there, and they sit there and they watch you the whole day to make sure that you don't harm yourself. Now, you may say okay, well, just take everything out the room. In the infirmary, there's nothing in these patients' room. The only thing they get is a food tray. Their toiletries are even kept outside the room so that when they need to brush their teeth and do all those things, somebody watches them do it so that they don't use it as a tool or a weapon to harm themselves. So they don't have anything in the infirmary with them. You may say, well, why do you need somebody there to watch them if they don't? Because when people want to kill themselves, they get very creative to do so. People bite their wrists trying to get to the artery. People bite their fingers. People try to break their toes. People, I know you saying breaking the toes and stuff ain't gonna kill them, but you don't want them doing any of those things. So you watch them because they're actively trying to do things to harm themselves, or if you go in there, they're going to try to harm you too. So they're on a 1-to-1 watch, and that's the first level. Now, in the infirmary, you can still have somebody in the infirmary, but not on a 1-to-1 watch. So these people are suicidal, but you have assessed them and they may not actively have a plan, but they do express that if they have the opportunity that they will do it. So you could put them on a 30-minute watch or a 15-minute watch. If you put them on a 30-minute watch, it means that a correctional officer goes by every 30 minutes. They have to log it, that they physically looked in, laid eyes on this patient, and that they were good. If you have them on a 15-minute watch, it means the same thing, but they go by every 15 minutes, lay eyes on this patient, and that they were good. When you sign off, you are signing off that you physically lay eyes on this person. So if something jumps off or something happens, and then God forbid somebody actually carried through on a suicide attempt, the coroner goes in there, they do an autopsy, and they say this person been dead a long time, and all these people been signing off. Some heads gonna have to roll. So we don't have that problem on our unit. The correctional officers that we work with are amazing. So that is the infirmary. Our sickest patients, our patients who are suicidal, our patients who could potentially be homicidal. And then we have another ward. So this ward will be like number 4. So on number 4, you have people who are not actively suicide, but could be very dangerous, or they're just not mentally well enough to kind of coexist with other people on a unit. They are very delusional, say stuff that just very delusional, and you can't really trust them around their peers or other inmates without potentially something happening. So these people are in a room by themselves. They are allowed to have things in their room. Like they can color, they can do different stuff in their room. They're allowed to do, because they're not actively suicidal, but they just not in a space where they could coexist with other, or they potentially will harm someone else. So they're in this tier by themselves, and they have group. The infirmary people, they do have a therapist or clinician come sit with them in a one-on-one cell. They play games with them. They play cards with them. They do stuff with them. They're not just in the room with like no, stimulation. They aren't just alone in the room. People do go and give them therapy, play games with them, play cards with them through the slide door on a prison thing. They don't open the door and go in there, but there's the slide door there. They set it up. They play cards with them and everything in the infirmary. In this unit, number 4, they get to have group in a cell, a cage like type of cell. Now, there's a picture going around on social media of San Quentin prison about, is this therapeutic? We're treating them like animals. And it is a very, very misleading post. It was posted by Sean King, if you guys know who he is on Instagram. And I typically like, his page, but I was very upset about that post because it's a very misleading post. Majority of the people on our unit do not have therapies in a cell or in a cage like they do. These are people who actively express they will harm a staff member. They will harm someone else if they had the opportunity, or they're just so mentally unstable that you don't know if they will do it or not. So of course, we're going to put them in a cage type of setting to give them therapy. At least they're still getting therapy. I think that post is very unfair and very misleading because it made it seem like everybody has therapy like that, and it's so not true. Most people have therapy in a classroom setting. They get crayons, they write, they do everything, all type of resources, whatever the clinician finds, they do all those things, and they're just sitting next to another person. They're not locked up in a cage. But if you got somebody actively saying that if they have an opportunity that they will hurt someone, why would we not put them in a cage type of setting to protect ourselves? Because guess what? The moment something happens to someone in a prison, like a doctor or a clinician or a correction officer, nurse, and it makes the media, everybody gonna be blaming the prison saying that they didn't do enough to protect the employee from somebody who, let's say for instance, in jail for killing 12 people. But y'all want to jeopardize our safety to make sure that this person who killed 12 people is not having therapy in a cage. No, he's getting therapy, or she's getting therapy. And I think that in itself is still a great thing that they're getting at. And once they become stable enough and there's a decision being made that they're not potentially homicidal anymore, or they're not, they're stable mentally where they could get, along with other people, then they graduate from that and then they go into having therapy like everybody else do. But you want me to risk my life to give therapy to somebody who actively said that if they have the opportunity, they will hurt someone? No. How does that make sense? So that's tier 4. Tier 3 and 2 are kind of like tiers where these people are kind of stabilized on their medication. Some of them are stabilized on their medication. They could walk up and down the tier when they're not on lockdown. They have tablets in their room. They have TVs in their room. They have coffee in their room from canteen, like stuff they order. They have all this stuff in their room. They could have pens to write with in their room because they are not actively suicidal or homicidal. That could easily change, but they have shown behaviors and improvement behaviors where we've made an assessment that that's, not a risk at those times. There are safety questions that we ask people every time we interview them, which, depending on where you are and what you have going on, determines how often you're seen by a mental health nurse practitioner or a clinician. And we ask them these safety questions all the time. Are you hearing or seeing things that nobody else is hearing or seeing? Are you having thoughts of harming yourself or others? And if that changes, will you let someone know? They have to answer all those questions every meeting that I have with them. So those are my safety questions before I leave the meeting. So those patients on those units are, they pretty much good. Then there's another unit, which will be like 1. And that unit is, these are people who are ready to go out to either the community, or these are people who are ready to go back to the state hospital. They are good. Usually some of them still have anxiety. Some of them are scared to go back to the community because they've been in the prison setting for so long. They kind of institutionalized. But from a mental health standpoint, they're optimized on their medications. They good with therapy. They've taken all the courses. They know how to utilize what they learn in therapy. And these people are ready to go. So some of the people in a unit who have done like heinous crimes, but they got off by not guilty by reason of insanity, which is called NGRI. These people, once they leave us, they have to go to the state hospital usually. And from the state hospital, they are basically followed for the rest of their lives. They have to check in. They have to do all this stuff with the programs, the agencies that I put out there in place to kind of monitor them, make sure they're staying on track, basically to keep them from coming back to the prison, doing a heinous crime. And the thought process is that they have been rehabilitated over the time that they've been in our unit and in the hospital, and they know how to utilize tools so that if they get out there and the world get hard, they know how to say, hey, I need help, before they do something to hurt somebody else or themselves. And I do believe, my short experience there, that there has been some rehabilitation on a lot of people from what I read in their charts that has happened to them and what they did to other people to where they are now. I feel like if I ran into this person on the street right now and didn't know their history, I would be completely bamboozled to think that, whoa, you did that? And I'm sitting here having a conversation with you because they're rehabilitated. I really think that it's possible. And I do think that when people are in a mental health state that's really, really bad, that they commit crimes, and it's very unfortunate. It's just very unfortunate. But there's another thing that as I work in this prison that I think about the people who tell me that demons are basically in control of them or telling them things to do to themselves or others. I do I don't know if anybody agree with me, but chime in down below in the comments. But when you see certain stuff on social media or the news or whatever it may be, do you ever think, because I do all the time, I do, when I see some of the stuff that's happening in the world, I'm like, this is not human behavior. This person is not mentally ill. That was like a demonic attack. I believe in demons, just like I believe in angels. And I do believe that some of the stuff happening in the world, just not, the person was under a demonic spirit when they committed certain crimes. I just don't think that is human behavior. Even in your sickest, like schizophrenic patients, I don't know exactly how to convey my thoughts about this, but I do believe that sometimes things that happen, people are under a demonic spirit versus a mental health crisis that's going on. I don't know, that was a little tangent I had because a lot of people in prison talk about when they're hearing voices that is demons or the devil himself telling them to do things. And I think they could say it's anybody, right? Why the devil? Why a demon? It could be anybody telling them things but why specifically the devil or the demon has told you to do this heinous thing? Maybe they did. Maybe it was real, but I don't know. I'm just exploring a whole lot of things in this setting because the heinousness of some of the crimes that people commit, and also the trauma that a lot of these people were born into. You know, can you imagine being born into a situation where soon as you were born, like you were already, the odds were already against you. As soon as you get of age, 5, 6, 7-year old, you're being molested by family. You have nobody to run to because everybody knows already. So you have nobody to run to. So you create personalities to kind of help you get through it. You start doing drugs very young to numb yourself. You start doing a whole lot of things in efforts to protect you from your own trauma, that the moments, something happens to you and you have an opportunity to do something different, you end up taking somebody's life or attempting to take somebody's life, or it's just like, hurt people. And I just didn't realize how much of the people, at least in my experience right now in this setting, 95% of the people were born into trauma and have a totally messed up childhood. And in turn, another thing, let's talk about sexual assault. Let's talk about molestation. If you grew up in a family system where you were being molested from, let's say, 5 years old all the way until maybe 16, 17 years old. You told your mom, nothing happened. You told your grandparents, nothing happened. You told cousins, nothing happened. Then you find out it's happening to cousins, and now it's y'all conversation. When y'all talk, nothing happens. It happened to you from an adult. How do you distinguish with mental health illness and it happened to you and nobody got in trouble? Now, when you grow up, you do the same thing to another child and you got in trouble for it. You spending years and years in prison for it. because something that happened in your family that you thought was okay and normal, because nobody protected you as a child from that same situation. You grew up and thought it was okay because everybody around you it was happening to, and the moment you do it you get in trouble. Now you're a sexual predator. And I just use that example because I've heard that story so many times. Like, so much incest and rape and molestation happen in these family systems, and when you grow up you do it because you think that this is what's supposed to happen, because nobody got in trouble when I told, and nobody helped me, so maybe this is okay. But the moment you do it to the wrong person and they tell on you, now you're in jail for years. And depending on where you are, sexual crimes, especially against minors, can get you more time than murder, depending on where you at in this country. Is people have life sentences for sexual crimes, and people have less time for murder. I'm by no means or no way am I condoning molestation, rape, or anything. But when you don't know, because you grew up in that environment and nobody was punished for doing it to you. Nobody told you it was wrong. Everybody just turned their eyes to you being molested for years, all of your life. And now you out here and then you try it, and then your fate wasn't the same as theirs. They walking away free. It's disgusting. They need to be where they are because they committed a crime. But for them, nobody was there for them. Nobody was there to protect them. And it's awful how much incest and molestation and all those things happen in family units, and everybody turn their eyes to it. That's something that, working in this setting, that I was like, whoa, we're so quick to judge people, when we see crimes on the media without knowing what they went through. Not that it changes it, but it does just make you take a step back and say, okay, you got to pay for your crime because you did commit the crime. But I do or feel sorry for you that you experienced that all your life and nobody protected you from it. So the moment you turn 17 years old, you go and try to do it, and boom, you in jail for the rest of your life for something that was happening to you all of your life, and nobody got in trouble. It's just horrible. Some people, childhood trauma that was never dealt with is the exact same reason why their adult life was snatched away from them. Their childhood was snatched away from them because they were raped, molested, or abused, or given drugs at very young ages. And now your adult life was taken away from you because nobody told you all of those things that was happening to you was wrong, because it was so accepted. So you get up and you do it, and now you're in jail. So your whole life has been snatched away from you, and it's all trauma related. A lot of these people have PTSD, obviously, from potentially the crimes they've committed, or the things that happened to them and the crimes they committed, as they are being rehabilitated to think about how wrong what they did was. Some of them don't even remember the exact details of what they did or how they got there, to that point in that moment. They remember doing the crime, but leading up to the crime, not necessarily what they were thinking, because they were so mentally unstable or out of control. Working in the prison has been very, very interesting for me. I have a tons of more things to say, but I'll save that for another video. And I'm still learning about that part, about just being a nurse practitioner in that environment, especially a new nurse practitioner. I think that I started with patients who are basically optimized on their medication regimen. So those are the patients that are like 2 and 3 unit that I told you about. There was a psychiatrist there who she took all the more acutely ill patients, which are in an infirmary or on the number 4 unit. So now I told her I want to start getting some of those more acutely ill patients so I can navigate through those, because once you get those acutely ill patients, you're figuring out diagnoses, you are figuring out what medications to, get them stable. That's what I'm doing now. I just got my first kind of acutely ill patient came in, and I started with diagnosing based on what he told me. I started with, a medication regimen. So yeah, this is good. This is good experience for me. When I leave here, my job marketability should be sky high, because like I said, the state hospital is where patients are usually the sickest, but the state hospital actually send their sickest patients to us. So we got the sickest of the sickest patients there. So, and we have a wait list. That tells you about the state of this world. We have a wait list for a secure psychiatric unit with sick mentally ill patients. That's crazy to me. I think that, I don't know. I don't know why. I never wanted to work in this type of environment. I've always wanted to do like outpatient anxiety, the working American who has like anxiety, depression, PTSD. I never really wanted to do like these acutely ill patients. But now I think I have a newfound love for it. Like, is prison nurse practitioner in my future? Another thing I like about where I'm working at too, the psychiatrists are great, and the nurse practitioner, we are peers. They don't treat me like, oh, you're just a nurse practitioner. They don't, in a teaching setting, because I'm still learning, they help me think things through with their experience and not make me feel like I don't know if you guys know, but there's a lot of disrespect for nurse practitioners from doctors in the healthcare arena. My friend is on a locums contract. She was on a locum contract in Louisiana. She's a Pmhnp. The hospital where she work at, the doctors don't even want the nurse practitioners parking in a doctor's space. We're equally providers. You guys went to med school. We understand that and we respect that. But when it comes down to seeing patients, we're peers. They don't even want them parking in the same parking lot as they do. It's kind of crazy. There's a shortage in healthcare everywhere. Nurses, LPNs, CNAs, respiratory therapists, nurse practitioners, doctors, you name it. There's a shortage. Why wouldn't you want help? If you try to get an appointment with your primary care doctor right now, the appointments are like 6 months out. Why you need help? Hire a nurse practitioner to come in there and help you see some patients. But you're so disrespectful to the nurse practitioner profession that you don't pay attention. Help us help you. That's how I look at it. Help me help you. As a doctor in the field who could potentially be overwhelmed, you could get a nurse practitioner out of school quicker than you could get a doctor out of school, because the schooling is so much longer. I think that's why they be low-key angry though, because they went to school and spent more time doing the same thing that we're doing without, going to all the school for it. That's my little rant on that. But anyway, that is part 2, or me working in the prison video, and I will see you guys in the next video. I promise I'm gonna try to be more consistent. I really have no excuse why I'm not consistent. So yeah, like, subscribe, turn on your notifications. Angel the Psych MP. Ciao.